Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for fainting or syncope. What is fainting? Fainting or syncope is sudden and temporary loss of consciousness, commonly not due to any serious reason, but the same is not guaranteed. That is, sometimes serious reason may be also cause of fainting. What are common causes of fainting? Exhaustion, heavy sweating, dehydration, overheating, injury, sudden changes in body position, etc. Certain habits, namely smoking, drinking, addictions, etc. What are the risk factors of fainting? Family history or genetics, male person, particularly aged over 60 years, person suffering from heart arrhythmias and coronary artery diseases. What are common signs and symptoms of fainting? Lightheadedness, sweaty palms, nausea, vomiting, blackout, that is loss of sight temporarily, headache, changes in vision. What are immediate follow-up of fainting? Lie down, preferably with head low position. First and foremost, because you know that's fainting, the sole reason for fainting is less supply of blood in the brain. So if you help supply of blood brain, make it easily, then recovery is very much soft, will be quick. So lie down means with head low, that is draining of blood in the head, and the fainting person fainted will almost immediately wake up. If cause is known, follow the routine. For dehydration, hydrate the patient. For disease condition, consult hospital doctor immediately. How fainting can be prevented? Whenever possible, make casualty lie down. That is, slightest symptoms of fainting appears, then this following step can be taken. Wherever possible, make the patient lie down. Hydrate the casualty. Sprinkle water over face. Avoid overheated, stuffy environment. Give some warm drinks like milk water, sweetened milk, etc. That will give some stimulant to their total body. It will help. That's warm water or warm milk water, etc. Discussions about treatment for fainting with homeopathic remedies. Aconite for fainting. Violent palpitation of heart. Congestion of blood in head. Buzzing in ears. Buzzing means various types of sound. Fainting as soon as patient raises from recumbent position. Recumbent position means lying or sitting, with chill and deathly paleness of face. Chamomilla for fainting. Fainting with dizziness. Dizziness, vertigo. Darkness of sight, hard of hearing, sensation of qualmissness, actually idleness, and flatness of the pit of stomach. Digitalis for fainting. Vertigo and dim vision precede fainting. Pulse very slow, nausea and deathly weakness in epigastrium. Lagdiflor for fainting. Faintness and nausea when stepping upon the floor in the morning. Extreme and protracted means long, continued. Suffering from loss of sleep at night. Depression with crying and palpitations. Basis for fainting. Tendency to faint in women. Apparent death. Neither pulse nor breathing perceptible after a pain in heart. From fright or grief. Asthma, vertigo, pale face, nausea, vomiting, pains, and stitches in the cardiac region with cold sweat, spasms, trismus, stiffness, and swelling of body. Trismus is facial muscle stiffness. Naxphom for fainting. Spells set in mainly in the morning or after a meal. Also suitable to pregnant ladies or persons worn out by mental labor or addiction to spirit. When nausea, pale face, obscuration of sight, pain in stomach, anguish, trembling present. These are the other conditions. Tabby come for fainting. Weak and faint spells with deathly paleness. Cold perspiration, sometimes with dilated pupils and trembling of limbs. Confusion of mind, vertigo, pulse small, weak, soft. Phosphoric acid for fainting. Paroxysm set in after a meal. Naxphom proves insufficient. That is generally after taking meal for any problem, Naxphom is the first medicine. But if Naxphom fails, in this case also, then phosphoric acid comes.